Hi, I'm Jessica.
I'm Katie.
And I'm Kayleen, and we're Level 2 students of the ASN program of State College of Florida.
And today we're going to be discussing the preclinical markers for the prevention of pressure ulcers. All right, our first patient today is a frail, underweight 79-year-old gentleman, Mr. R, who presented to the ER with symptoms of a heart attack. His blood work showed high troponin levels. His ECT showed elevated ST segment. He was scheduled for an emergency cardiac catheterization, but due to his unstable condition, he was transferred to the ICU for continuous monitoring prior to his procedure. Then, due to his findings, Mr. R was transported directly into open heart surgery.
That's a lot of time not being able to move for himself. What was the condition of his skin when he returned to the ICU?
Unfortunately, due to Mr. R's frail form and bony prominences, he returned to the ICU with stage 1 pressure ulcers on his coccyx and his left heel, even with all the precautions done during surgery.
That's not good. He has to lie flat for another 4 hours. Is there anything that can be done to lower his risk of pressure ulcers?
Well, according to a 2015 study of 150 critical care ICU patients, applying a preventative silicone foam to the coccyx and heels of the patient prevented pressure ulcers in 136 of the cases. Of the 14 patients who didn't receive the preventative silicone foam, 19 of those pressure ulcers were detected.
So preventative care to those bony prominences can really help to cushion the skin. Good to know. Our second patient today, Mrs. N, is a diabetic overweight elderly woman on a med-surg floor. She's recovering from bariatric surgery, has a JP drain, and is refusing to get out of bed due to her pain. She isn't moving around in the bed by herself, and she's being very reluctant to do anything. This is extremely frustrating to Mrs. N's nurse, who has another 5 patients to handle. Then the nurse gets another 2 patients added on.
Wow, that's a disaster. Mrs. N's nurse doesn't have time to take care of her with her 7 patients. What will this lead to?
Well, this means that each patient can't receive the proper care that is needed. Mrs. N started to complain that her bottom was hurting, but not enough was done. So the nurse was simply overwhelmed with too much to do. During shift change, the nurse coming onto the floor observed a stage 3 pressure ulcer on Mrs. N's coccyx. After debridement, this was the photo of our patient's stage 3 pressure ulcer.
Well, that's horrible for the nurse and the patient. There has to be something that could have been done to prevent this.
Well, a study published in 2015 states that having a low nurse-to-patient ratio increased patient safety, and the instances of pressure ulcers went down. There was also a study published in February of 2014 that tested the pressure distribution of the body on a sheepskin mattress compared to the air mattress. The sheepskin mattress showed more pressure distribution, which decreases pressure on high contact points and lowers the instances of pressure ulcers. Either of these 2 things, or both, could have saved Mrs. N and her nurse from this pain.
On October 16, 2017, a study published that involved a new way position patient. This position is called Laguna in Neutral Stellum, or LIN. This position was designed to support the body more evenly and allow the joints to be neutral and relaxed, meaning joints should not be extended, flexed, abducted, adducted, or rotated. Hollow spaces should be avoided so that for all body parts are supported against the influence of gravity. Doing this will allow more support surface and less pressure on those high contact points, shown here on our Inflex measuring system. This will decrease the likelihood of pressure ulcers. And here's the conventional position that many nurses use today. This position only focuses on supporting specific body parts and allows hollow spaces between the bed and the patient. This decreases the support surface and causes more pressure on those pressure points, as shown here. Eventually, gravity will weigh down on those body parts and increase the risk of pressure ulcers.
Wow, that's interesting. Is there some place that we can learn more about the LIN position?
This study can be found on BMC Nursing by simply typing in neutral positioning in the search box.
Okay. So, ladies, what have we learned?
Well, we've learned that use of silicone foam dressings, a low nurse-to-patient ratio, the use of sheepskin mattresses, and this new LIN positioning can significantly decrease the instances of pressure ulcers. These studies are showing good things for patients and for nurses.